Well, Dr. Bright Oris-Ohwerhi is a medical practitioner, joins us further to discuss this. Thank you very much, Dr. Oris-Ohwerhi. What is the current prevalence of hepatitis B and C in Nigeria, and what are the major risk factors that contribute to the spread of this particular disease or infections?
Okay, thank you very much. There is about 8.1% prevalence rate for hepatitis B and 1.1 currently for hepatitis C. So that is quite high for a population of over 200 million people. That means quite a lot of people currently have hepatitis B or C, and it's quite serious. So some of the risk factors for the hepatitis, of course, and the awareness that people can contract hepatitis, and then it's one of its the means through which the disease is contracted. Infection is contracted is also one of its through sexual means, unprotected sexual intercourse, sharing of sharp objects with people, and through birth. Sometimes women who are pregnant, they don't really screen for the infection, and because of that, they are able to transmit it to their children from birth. So these are some of the risk factors for people contracting hepatitis.
How can healthcare professionals like yourself, and organizations raise awareness about hepatitis among the population in Nigeria?
Okay, so there's something I always believe in. The best way to raise awareness is from the very basic level, which is the primary healthcare centers. Now, every clinician, every medical practitioner, every medic is charged with the responsibility of creating and raising awareness, informing the public about the disease, the infection, what it does, and how to prevent it and how to treat it, right? So raising the awareness from a very basic level, the primary healthcare centers, I think, would be most useful in raising this awareness and generally improving the way we've been approaching that infection.
And Bright, what are the recommended, screening and diagnostic methods for hepatitis B and C, and how accessible are these tests in Nigeria?
Okay, so I believe at the primary healthcare center, I believe that there's a lot of work that is already going on that level. Basic just blood tests. Blood test is sufficient to diagnose the virus. You screen by doing just a simple blood check to check the presence of the virus, the antibodies, or of the virus, the antigens, or if it's present, right? So there's what we call the hepatitis panel, where you screen for all the kinds of hepatitis, especially hepatitis B and C, and you're able to tell if it's positive in this person, if this person has had the infection, if this person has been vaccinated, against the hepatitis virus. You can also tell from these screenings, and from that result, you can approach the person and initiate the kind of treatment that the person needs.
Interesting. And what treatment? Talking about treatment, what treatment options are available for individuals who are diagnosed with hepatitis B and C in Nigeria? And what are the challenges of providing effective treatment?
Okay, so hepatitis C is completely curable. It's curable. So treatment is available for hepatitis C. Hepatitis B is not curable, but it's manageable. So there's treatment to manage hepatitis B, to prevent the spread, to prevent it from becoming chronic, to prevent it from developing into a chronic liver pathology. That is for hepatitis B. So there is treatment for it. For hepatitis C, it's completely curable. Now, access to the treatment. I believe there is access, but based on how many Nigerians are suffering from the disease, and of course we know that a large population of Nigeria is the lower socioeconomic areas. So we see that it's going to be challenging because a bottle of, a tin of an antiviral medication for treatment of hepatitis B can cost up to 30,000 naira, right? And so how much does the average person in Nigeria make, right? Is it sustainable? And because this is the chronic condition and the person needs to be on treatment for a while, it becomes very difficult to keep up with treatment because of the cost. So the cost is really expensive, especially you want to get good products. It's quite expensive in comparison with the average wage of Nigerians. But the good thing is that it's completely preventable, especially hepatitis C. You can get vaccinated. So you get vaccinated, you get your shot, and then you are protected from hepatitis B. You would not need to go through the whole hassle of trying to procure the medication at very expensive prices. So the best way to solve this is just, screen yourself, and if you're negative, just get vaccinated. There are vaccines in primary healthcare centers, in government facilities. I know that there are also vaccines in most military facilities. Right, military hospitals, military healthcare centers, they are free, and these vaccinations are free. So I think that there's ample access. I think the access can be more, especially at the primary healthcare level, doing community outreaches and all of that. But there is vaccination, and it's easily accessible. For the medications, for treatment and management of hepatitis, it's a bit expensive, and something needs to be done in that area.
Right. There's a lot to unpack as far as this is concerned, but very, very vital information you shared with us there. Dr. Oris-Ohwerhi, thank you very much for your time. We appreciate it.